Hello everyone, I'm Dr. Sharvari Pandit. I'm a dermatologist at Pandit Clinic in Pune. I'm talking to you today on the behalf of DermaVidya. Today in this video, I shall be talking about vitiligo and its treatment options. Vitiligo is a skin problem. So it is basically presenting as light colored or white colored patches on the skin. What exactly happens in vitiligo is there is some change in your immune system that causes your cells, the melanocytes, to die. They do not produce the black color, and that's why some sort of patches on your skin start looking white. It is basically not a problematic disease. It cannot be spread to anybody, but there is a lot of social stigma that is associated with vitiligo, and that's why there are a lot of patients who are seeking treatments. A lot of vitiligo patients suffer from a lot of emotional disturbance and also social outcasts. We really have to remember that this disease does not spread by touch. Even if you are in contact with a vitiligo patient for a very long time, you will not have vitiligo just by touching the patient or spending time with the patient. There are two major types of vitiligo. There is a vitiligo called segmental vitiligo, and there is another which is a non-segmental vitiligo. The segmental vitiligo is basically a small area of skin that is involved. So this area of skin is guided by one nerve. Only that area gets affected by this type of vitiligo. So you see a very small patch of vitiligo on one particular area of skin. It is a localized form of vitiligo and it does not spread. It is quite easy to correct. A lot of surgical intervention can be done early in this stage of vitiligo and it can be treated. There are a lot of times that this vitiligo does not come back. The other variant of vitiligo is called vitiligo vulgaris, or it is a generalized vitiligo, also called as lip tip vitiligo. This vitiligo starts around the cavities, so the oral cavity, the lip, the eye area. It can also start with your fingertips. This is a type of vitiligo which is autoimmune in nature. This vitiligo can spread. It can spread all over your body. In this vitiligo, your body's own immune system starts targeting your melanocytes. It is attacking them, killing them, because of which the melanocyte, which is generating color for you in your skin, dies out and it cannot produce color in that particular area. If eventually all the melanocytes in your skin start dying away, you start getting whiter and whiter. So all your skin patches become white and there is a possibility of generalized vitiligo wherein your entire skin surface is white. The exact cause of vitiligo is not yet known. A lot of times a genetic predisposition can be seen. So there is a little higher possibility of passing this vitiligo, the generalized variant, to your kids. But again, it is not very predictable. So there is somebody who doesn't have any family history of vitiligo can still get vitiligo. Or if there is a high family history, there is still possibility that your kids can be born without any possibility of vitiligo. There is another variant of vitiligo, which is again a localized vitiligo, that is called contact leukoderma. A lot of times some irritant can cause a localized damage of melanocytes, which can cause white patches. Something like sometimes a footwear which has caused trauma to your feet can cause vitiligo. The most important treatment for vitiligo is mental support. The kid should be supported at the school. All the adults should be supported throughout their life and also during their marriage process. There should be a lot of care and passion dedicated to treatment of vitiligo patients. The very first basic treatment of vitiligo starts with topical applications of creams. So a lot of corticosteroid creams, tacrolimus, pimecrolimus and the newer JAK inhibitors can be made available in the topical formulations and they can be used to arrest the patches. Also, there are some creams that induce repigmentation. So whatever color you have lost, you can start regaining the color with the use of certain creams. You can start using a phototherapy along with the application of creams. So there are certain UV chambers, it's called UVB phototherapy. There are certain lights, the lamps or the lasers called excimer lamps and lasers, which can be part of your phototherapy. The phototherapy treatments are very safe and can be done at all the ages. There are certain photosensitizing molecules which are used as tablets or sometimes even oils, liquids, lotions. So you have to take these tablets and expose yourself to the sunlight. Sometimes you have to apply these creams or oils on your skin and expose yourself to the sunlight. You can also use these along with the phototherapy. One of the most commonly used and safe treatment is the narrow band UVB treatment that is very effective for vitiligo. There are certain patches of vitiligo, they do not respond to any treatment in spite of all the efforts. At these times, surgical options can be thought about. For surgical correction, the vitiligo patch must be stable. What do you mean by stable? Is that a patch that has come should not be increasing in size and you should not be getting any new patches. The general stable term is used for about 1 year's time when your vitiligo patches have not increased. This is a good time you can think about getting a surgical correction done. When there are small patches of vitiligo, something like really tiny on your skin, it can be directly excised. So what is excision? So you have a small patch, it is directly cut, removed, and the normal skin is stitched back together. So you can treat small vitiligo patches directly with surgical excision. When the patches are slightly bigger and you cannot excise them surgically, a lot of other surgical options are available. Skin grafting has been commonly used in treatment of vitiligo. You can use a full thickness skin graft, or there are certain grafting methods like a mini punch graft, like a punch graft or a blister graft. All these can be helpful. Blister grafts are generally done around the mucosal area. So if you want to treat your eyelids or if you want to treat your lips, you can use a blister graft for surgery. There are certain punch grafting techniques where tiny punctures are made in your normal skin and the epidermis, your cells which produce skin color, are transferred to your area where you have vitiligo. The newer modalities include melanocyte transfer. So there are cultured melanocytes and non-cultured melanocytes. So basically it's like you're getting the melanocytes, the cells from somewhere else on your body, you make them into a suspension and you add them to the area where there is no color. So once they get into your skin, they start producing melanin and these cells grow and they repigment very nicely. So the advantage of a melanocyte grafting or transfer is that the repigmentation is very uniform. In extensive cases of vitiligo where almost the entire body has turned white and there are certain patches which are remaining, even a bleaching option is available. So instead of trying to cause pigmentation, repigment the entire body, certain areas of body, certain patches of body which are not turned white, you can use a bleaching cream and bleach them away and make it uniformly white. These bleaching agents are quite difficult to use. You have to do it under a medical guidance. It can cause irritations and there is a specific pattern. So you'll have to see your doctor if you're thinking about bleaching them away. I hope this video has given you a little insight about the comprehensive approaches to vitiligo treatment, and it will help you and your family, if at all anybody is suffering from a vitiligo, deal better with your disease. I thank you for watching this video. For more information on your skin and hair related problems, you can anytime visit dermavidya.com. If you're suffering from any problem, please do visit your dermatologist. Self-medication is not good for you. Keep watching, learning and sharing. Cheers. Thank you.
For more such videos, visit or log into dermavidya.com.